Hello and welcome to video 19, the final video of the Licensing Education Series by AIC, a partner of American Senior Benefits. These videos should be used in addition to your study material, not as a replacement. I've simplified the material for these videos to give you an overview of the topics you're going to have to study. Please watch each video all the way through once without taking notes, and then go back and take notes. You'll find that you retain more information that way. If there are any topics you would like me to do a deeper dive into, please comment and tell me the specific information you want me to go over. Thanks for attending, and let's get started. So this video is going to go over replacement and some terminology. Replacement of one policy with another is pretty common. When an insurance producer is considering one, they should keep a few things in mind. First is, are they twisting or churning the business? We discussed that in an earlier video if you need to refresh that. Does it better the policy owner's position? For example, are they getting a lower premium or better coverage for the same premium? Will there be a new waiting period? Should they be concerned with a new contestability period? Are there exclusions or limitations on the new policy that the old one didn't have? Is there going to be any kind of surrender charge? Are they losing favorable loan status? Are the new provisions as good or better than the old ones? Basically, be diligent and ethical when replacing a policy. Getting a good paycheck isn't a good reason to replace a policy. Now, if the producer does decide that the replacement is in the best interest of the policyholder, a couple of requirements must be met. First, double check all this stuff. Then the producer must have the client sign a replacement notification and be given a copy, and that notice will also be supplied to the old insurer by the new insurer. Okay, well, that's replacement. Now I'm going to go over some terminology. I'm just going to list some terms and define them. These are terms that are in the outline for Oklahoma. If you want any more detail on any of these or anything that I don't go over, please let me know. So, a minor. In Oklahoma, as in all states except for Alabama, Nebraska, and Mississippi, anyone under 18 is considered a minor. Domestic. Domestic is an insurer that's operating in the state where it's chartered and its headquarters is located. Foreign. A foreign insurer is operating in a state other than where it's chartered and its headquarters is located. An alien. Alien is an insurer that was incorporated in a foreign country. So don't confuse foreign and alien. Alien is in a foreign country, but foreign is in other states. Okay, the Fair Credit Reporting Act. Mentioned that in the last video. But the Fair Credit Reporting Act is the law that requires applicants to be notified if they're going to have an inspection done. Fraternal Benefit Association or Society. There are a lot of purposes for benefit societies. One of the earliest in America was actually formed back in the 1780s by two former slaves called the Free African Society. In our case, it would be a group formed for insurance. The benefit society has to be not a nonprofit. It has to carry out charitable programs. And it has to offer insurance to its members. There are several popular fraternal benefit societies that producers work with. But keep in mind, fraternal benefit societies are not covered by the State Guarantee Association. What is the Guarantee Association? Well, in Oklahoma, it's called the Oklahoma Life and Health Insurance Guarantee Association. It's an organization established by the state and funded by all the insurers operating in that state to protect policy owners in case an insurer becomes insolvent. In that case, the Guarantee Association covers the policies in force with that company so that the insured isn't left without coverage or lose money in the case of life insurance or annuities. But there are limits to the amount covered. All right, marketing. Marketing is the overall plan on how to get an insurance product to market. Advertising is a component of marketing. It's promoting the product to the public. Both marketing and advertising are regulated by the state. Suitability. Suitability is determining if the insurance is right for the applicant. The Unfair Claims Settlement Practices Act. This protects policyholders from various unfair settlement practices being committed by an insurer. Rebating. Rebating is giving the insured money or other things of value to get them to buy a policy. Each state has its own laws about this, but basically, if the producer is giving the insured money or items to reduce the premium or to share the commission with them, it's considered rebating. Inducements. Inducements are gifts over the legal amount allowed by the state to encourage a person to buy insurance. And getting the gift is usually dependent on buying the insurance. Inducements are actually a form of rebating. Defamation. Defamation is communication about another producer or insurer that is untrue and unfavorable. Federal Regulation Fair Credit Reporting Act, the FCRA. This regulates how credit reporting agencies can collect and share data they collect. Federal Regulation Fraud and False Statements. That governs making and using false documents or writing. Probationary period. The probationary period is a time after a policy is issued, but before coverage is in effect. Probationary periods are common in group health. All right, elimination period. An elimination period is a time-based deductible. These are common in disability and long-term care policies. It's a specified amount of time between the beginning of qualifying to receive benefits and when the benefit starts being paid. For example, if the policy owner has a 90-day elimination period on a long-term care policy, that person would have to pay out of pocket for the first 90 days before the policy started paying out. Coinsurance. Coinsurance is a percentage-based coverage. For example, if the policyholder has an 80-20 coverage, the insurer will pay 80% of the bill and the insured will pay 20%. Deductible. A deductible is a dollar amount that an insured has to pay out of pocket before the insurance kicks in. For example, if the plan has a $1,500 deductible and an 80/20 coinsurance, the insurance would pay, or the insured would pay all of the bill for the first $1,500, and then 20% of the bills from then on, usually up to some kind of cap. However, with Medicare Part B, which is the medical part, there's a coinsurance, but there is no cap on the amount. Copayment. A copay is a fixed amount paid for a service or product, like $20 each time you go to the doctor. COBRA. COBRA stands for the Consolidated Omnibus Budget Reconciliation Act, and it provides continuing coverage of health insurance upon the loss of group health after a qualifying event, like death or termination, divorce, going on Medicare, the employer canceling the plan, or going out of business. Depending on the event, the coverage lasts up to 36 months. Now, COBRA only applies to companies that have 20 or more employees. HIPAA. HIPAA is the Health Insurance Portability and Accountability Act. The portability part makes it so that if an insured has been covered for at least 18 months and changes employers, they can immediately get coverage at the new employer without having to go through a probationary or waiting period. The accountability part of HIPAA is the part that's about privacy and record keeping. Okay, so that is the end of the pre-licensing series. I hope that the information in these videos was helpful and easy to understand. If you have any other questions or topics you want me to cover, please let me know. And after you take your exam, please let me know how you did. Thanks for watching and good luck.